Hi, I'm Amy McCurder. Welcome to House Calls, brought to you by KiMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Rebecca Reddy of Wichita about infectious mononucleosis. Thanks for being here today.
Thank you.
Let's just start with, what exactly is it?
So infectious mononucleosis is called mono by everyone. It's a viral illness that's caused by something called the Epstein-Barr virus. And most people are infected with mono sometime during their lifetime.
What are the symptoms?
Young kids who get mono, kids less than the age of 8, often just have a kind of severe common cold, and no one ever really recognizes that as mono. Adolescents and young adults usually have an extremely sore throat, often swollen lymph nodes in their neck, and the illness persists, perhaps with fever, for 7 to 10 days or longer.
How does it spread?
It's spread by respiratory droplets and saliva, and that's how it became known as the kissing disease. So it's often with teens and young adults who are sharing utensils or glasses.
Who's most at risk?
The most at-risk group is teens and young adults because they often live in close quarters, such as a college dormitory, and they're the ones who are at most risk for a prolonged illness.
What symptoms should you watch for?
The symptoms to watch and plan for really are abdominal pain, because that can indicate that the spleen is enlarged, and then you have to avoid contact sports for 1 to 2 months. Also, teens and young adults can be often very fatigued, and then they require sometimes modified school schedules if they can only attend half days. And schools usually have to work with these families because it can go on for 1 to 2 months or more sometimes.
Okay, how do you know when to call the doctor?
So it's important to call the doctor if your child has a severely sore throat that lasts more than a week, if they're excessively fatigued and don't start improving with their energy level within a week to 10 days.
Okay, good information, thank you.
Thank you.
Please join us next week for a new health topic discussion on House Calls.